Hurricane Sally's really roaring outside today, folks, but I'm going to try to get this presentation on vascular dementia done today. I may have to stop if the power goes out because the storm is really roaring, but I want to try to get this done for you if I can today and get it uploaded. I'm Sonia Liebendorfer, and I'm going to be talking about a close to home subject. My mother was diagnosed with vascular dementia last year. And so this particular topic hits very close to home for me. And so I'm going to add some of what I've been through in terms of things as a caregiver, in addition to the content that's presented here. Now, vascular dementia is a general term that describes problems with reasoning, planning, judgment, memory, and other thought processes. And it's caused by impaired blood flow to the brain. Now, I touched on it a little bit in the first video that I did on the different types of dementia. But vascular dementia, as far as the cause of it, this impaired blood flow can be caused by a number of things. It can be caused by an ischemic stroke, which is a stroke that's caused by a clot that occludes the vessel. It can be caused by high blood pressure. High blood pressure makes the blood vessels very brittle. So I want you to think about those bristles that are on a broom, how stiff they are. Normally, your blood vessels are very pliable and they have a lot of give and a lot of flexibility. But when you have high blood pressure for a long period of time, those vessels get very brittle, just like those broom bristles, and they get to where they don't have that much give and that much flexibility. Also, a cause is high cholesterol. And when you have high cholesterol, you can have cholesterol building up on the vessels of the walls. And the vessel, when the vessel walls have all that buildup, the actual area that the blood has to flow through gets very narrow, and it becomes easier for it to become occluded. Now, some other conditions that can cause the blood supply in your brain to be such that blood and nutrients and oxygen can't get up there are small vessel disease, usually caused by diabetes, as it is in the extremities with the feet, or it can be from a mass or a tumor. Sometimes there are small vessel diseases that are just in and of themselves caused by genetic reasons that would cause the blood vessels to be at risk. Now, the factors that increase the risk of heart disease and stroke are some of the same factors that cause vascular dementia, and they are a history of diabetes, high blood pressure, high cholesterol, and smoking. And the reason that smoking ends up being a factor is what smoking does is if you have the cholesterol with smoking, it makes all that cholesterol stick to the walls of the vessels faster and cause occlusions. Don't know what causes it in the smoking that does that, but they have found that for whatever reason, smoking does make the cholesterol stick to the vessels faster. So that's why it is a risk factor. Now, if you control the risk factors, it can help lower your chances of developing vascular dementia later on. Now, depending on where the blood flow is impeded in the brain, the signs and the symptoms can be as follows. It's not an all-inclusive list because you'll have some but not others. So if you just see some of these on this list that look familiar, then it's cause for concern. First, we have confusion. They're not sure about what day it is. They're not sure about what time it is. They get ready an hour earlier than what they're supposed to be ready and yell at you for being late when in fact you're on time to pick them up for an appointment. That's a good example of that. They have difficulty paying attention and concentrating, being able to balance a checkbook or doing anything that you have to concentrate for a period of time to do becomes extremely difficult for them. The ability to organize and collect your thoughts or decide what you should do to solve a problem, this is a classic with them. They can't really analyze a problem to be able to figure out the steps that they need to do to fix a problem anymore. So that is a one of the big ones that you'll see come into play because it becomes difficult for them to put the steps together to know how to initiate action. Now, you will notice a decline in the ability to analyze the situation and then develop a plan on what they need to do to correct it. And then you'll notice that they have a difficult time conveying that plan to others. And it's usually the frustration with that that causes them to become very agitated and sometimes start saying hurtful things to you just because they're frustrated with the fact that they can't do what they need to get done and they don't want to admit they have a problem. They have a hard time deciding what they need to do next. They need a lot of structure and a lot of guidance because they get easily bumfuzzled about what they need to do. They have a lot of problems with memory. They have a lot of problems, especially with short term memory. You'll start hearing them talk more and more about the past, about the way things were when they were growing up, about the way things were back when they were working, um, because that's what they can recall. They can get very restless. They can get very agitated. They can get combative. My mother got to the point she was throwing stuff at me. And that was when I realized that there was really a lot more that just met the eye with what was going on with her. They develop problems with unsteady gait. Walking becomes a problem. Balance, coordination become issues. Then they have problems where they either hold their urine for a very long period of time because they have difficulty initiating flow, or they have problems with incontinence, and they have problems with depression. Everybody, when everybody their age starts passing away and they're left behind, then that starts to hit hard with them because the people that they used to be relate able to relate to that are their age, they're not here anymore. And if they don't have depression, then they can get very apathetic. They just don't care about anything. So these are all things that you can see with vascular dementia. You don't see all of them, but you can see some of them. And as things progress, you will see more and more of the things come to fruition of being unable to communicate, unable to find the right word, and incontinence. Both ends of incontinence become a problem as it progresses. So these are things that you will see down the line with this. And it's just things that you have to consider that you're going to have to make arrangements for interventions for because you're going to need help with taking care of a patient that has this, you're not going to be able to do it on your own. Now, you'll remember in the first presentation, I talked about the mixed states. And a lot of times, vascular dementia will accompany Alzheimer's. And I have been looking for that in my mother since she was diagnosed last year because her mother had Alzheimer's and her sister had Alzheimer's. So I won't be surprised if I start seeing the mixed states with her. Now, how do we diagnose this? You can have a CT scan of the brain, which is a test where they go and look at how much the brain has shrunk, because that's what happens with dementia. All of the brain shrinkage, you have less brain mass to be able to carry out the bodily functions. And as you start to have strokes or blood vessel changes or tumors that affect the blood flow to areas of the brain and end up cutting off the circulation, that part of the brain dies. Sometimes you'll see them use the contrast dye in the blood vessels and in the tissues of the brain because it can help to highlight a near occlusion or it can help highlight a mass. You pretty much have to have contrast dye to be able to see a brain tumor because they're normally very difficult to see unless you have the contrast dye. And the contrast dye makes it just basically pop on the screen so it becomes very apparent. A better test than that is an MRI. Now, the MRI is good because it can give even more detail about strokes and about any blood vessel abnormalities. Now, I want to share a story with you about this because my father, back when he had Parkinson's, he had a lacunar stroke, and we didn't see it on the CT scan. They waited the next day and decided to do an MRI of his possible stroke because he started stuttering out of the blue, and we knew something was going on with him. And then I noticed that his facial features on one side were drooping. When we did the MRI, the stroke showed up. It actually showed up as a blockage in one of the vessels in his brain. So it is very important if you have a CT scan to check for a stroke that they follow it up 24 hours later with an MRI. Because a lot of times, if there is a stroke going on, it will not show up in an initial CT. But if you do an MRI 24 hours later, it shows up. But they have to wait that 24-hour period. Another thing that they can do to check and see if there's any blood vessel narrowing or potential blockages is they can do ultrasound studies on both sides of the neck. The carotid Doppler studies are used on the carotids on each side of the neck to see if there's any signs of narrowing of the great vessels that go up to the brain. Now, if they do find blockages or something that needs to be taken care of, a neurosurgeon can do a surgery called a carotid endarterectomy, which basically they go in and roto-root and clean out the carotid if there is going to be almost a complete occlusion of the vessel. That is something that they can do. Another thing that they do to kind of get an idea of where the deficits are is there is a profession called a neuropsychologist where you can take a loved one and they spend a couple of hours with that person and give them some tests so they can determine just where all the difficulties are. And they will test their ability to speak and to write and to understand language. They'll also see how well they're able to work with numbers and manipulate numbers. And then they also will see how well they can learn and remember information. They'll tell them to remember about 5 words, and then they'll change the subject. And then about 5 minutes later, they'll ask for all those 5 words back just to see how much they can recall. They'll give them a problem and they'll tell them to develop a plan to solve it. And that's the part that a lot of them have problems with because they just can't come up with the plan and the steps that they need to do in the right order of the steps. And it becomes very frustrating for them when they have to do that kind of problem. And then if you just give them a hypothetical situation, something that isn't real, something that hasn't really happened, and ask them how they would deal with that, they can't really do that because they can't grasp abstract thought anymore. They need things that are concrete and in front of them. And even sometimes that's difficult for them to grasp and fathom what to do with it. Well, what can they do for treatment? Really, you just control the risk factors because there is no cure. If a person has high blood pressure, then you do the best you can to make sure that they maintain a normal one. If they have high cholesterol, you do what you can to get the cholesterol lowered. If they smoke, you try to get them to stop smoking. You have to do what you can to keep the arteries clear. There's a heart condition that's called atrial fibrillation, in which the heart just shakes like a bowl full of jelly because the rhythm mechanism is out of whack. The top part of the heart will beat faster than the bottom part of the heart, and it end up can cause clots. So they end up having to put them on medication to make sure that the top and the bottom beat at the right rhythm and make sure that they control the blood pressure for these folks. And when they do that, they have to put them on a blood thinner because their blood just kind of has a tendency when their heart gets out of rhythm, their blood just has a tendency to sit there and can form clots, and that's how a lot of people end up with these clots that block arteries in the brain. So they have to make sure they put them on a blood thinner. And that's what happened to my mother this week. She was having dizziness. She was having blood pressure was all over the place. I said, I'm taking her to see a cardiologist. Sure enough, they diagnosed her with AFib. Told me about the risk of blood clots, which I already knew. And this seems to be a hereditary problem because my grandmother had AFib as well. And it seems to be a hereditary thing after age 80 that this shows up. And I think it has to do with just the heart wearing out and the mechanism that governs the rate just gets worn out after so many years. So they have to put them on medications to keep that rate in check. But the medications also control their blood pressure. So it's like a double medicine because it keeps the rate in check, but it also keeps the blood pressure in check. But because of the AFib and the potential for clots, they had to put her on a blood thinner. And so this is something that I am newly aware of because this is something that just happened to my mom this week. The other thing that you can do is control your sugar if you're a diabetic, because just like diabetes affects the extremities in the feet, the blood vessels, and their problems with circulation, you can have that same problem in the brain. Um, Make sure you participate in regular physical activity. It's important that you stay active and that you try to eat healthy. Make sure you try to engage in social activities to keep your mind alert. You want to try to use your mind as much as possible to keep it active. And make sure you challenge your brain. Make sure you do games and puzzles, and you learn new activities by taking classes or listening to a different kind of music. Just do different things that are going to challenge your mind and that will keep your mind younger, so to speak. Now, there are a lot of resources out there for caregivers. There is the Alzheimer's Association, which you can get a lot of information from them about all types of dementia, not just Alzheimer's. There are a lot of local support groups that you can attend. If you can make friends of some people at the support groups and just have lunch with them or something, just to get away and just to kind of have somebody to talk to that understands about what you're going through, those are very helpful. There are some places, I know we have one locally that has agencies on aging that have a whole list of different companies and resources that you can contact for help. A lot of times there are organizations that have volunteers that will come in and help out the caregiver, because it can be very taxing and it can just be to the point of overwhelming, especially sometimes when they're being combated and things get really difficult and really tense. Sometimes it helps to have an extra person there that can help you come and take over the care for a little while you get away and just have some time for yourself. I encourage you to look up the information on Tipa Snow. She actually has a complete website now, tipasnow.com, and she has seminars and stuff that she does. If you can find any kind of seminars, any kind of classes to really understand what's going on, it really helps you to relate to them and to relate to what they're going through. I can't emphasize enough the points that are listed on this page, that you need to make sure that if you don't have the legal affairs in order with power of attorney, that you get all of that stuff in order. Make sure you give a lot of encouragement to the person that has vascular dementia to retain their dignity and their self respect. Because once they realize that they're failing mentally, at first they get angry. At first, they're very resistant to anyone helping them. But then they reach a point of, I'm glad you're here to help me. And it can seem like forever before that moment comes, but once it does and they realize how much they need your help and they vocalize that they realize that they need your help, then the road becomes a lot less bumpy. But when you're getting to that point, when you're first starting to go through this, it can be extremely overwhelming emotionally. It's very important that you provide a calm environment for them and that you provide a lot of structure for them, because they worry incessantly about the least little thing, no matter how many times you reassure them. It's best to keep everything to a routine and to try to keep things as structured as possible in terms of activities. and to make sure you do activities together so you are spending time with that person doing something that you both enjoy. And do try to respect their independence for as long as it's safe. Once you see that it reaches a point that they're no longer safe to drive, then if they fight you on still driving, what I did was we went to see the neurologist, and I had him to recommend that she take a driver's ed program. And he told her that until she took the driver's ed program, she wasn't going to be able to drive because she had to prove to him that she could pass the test. Well, she didn't pass the test. She flunked it terribly. And so she was not able to drive after that. So that took some doing because I was extremely worried every time she went out in the road. She would drive down the wrong side of the road on one occasion, but yet she wanted to think that she could continue to do things by herself, and she wouldn't tell me when she was going out. So I ended up having to buy one of the GPS little activated things that you put on a vehicle that would alert me whenever she was leaving the house to go somewhere. So I would at least know when she was out and about and driving because she just wouldn't tell me. She was trying to sneak out. But I could follow and see where she went by GPS, and I would see how much she got turned around and how much difficulty she would have getting back home. But the police weren't very helpful. I talked to them and I was told them I was concerned about her safety. But the real key was getting that driver's school to tell her that she didn't pass the driver's test. Once she didn't pass the driver's test, that was it. She just accepted the fact that she couldn't drive anymore. It wasn't easy because she was so used to independence, but she realized that it was no longer safe for her to be behind the wheel. Sometimes that's a very tough thing to accept. And please remember, as a caregiver, you have a very tough job. It's very emotional and very demanding, and you will need a break. Don't feel guilty for needing to take time away to recharge your batteries. You need to make some time for yourself to relax and do what you enjoy every day. And then, as it is possible, you need to have someone to come and stay with that person so you can get out and take care of the things that you need to do, such as getting groceries or taking care of things that you need to get done. Because when you're with that person all the time, you can't forget about your own needs. And it's very easy to do that when all you are ever confronted with is their deficits and what they don't have and what they can't do. But you can't let that take away from your identity. You have to stay engaged. You have to stay involved in doing things that you enjoy, whether it is going out with friends to dinner, whether it's going out with friends to a movie, whether it's getting away on a vacation over the weekend. You have to have time to recharge your batteries because you think about all the energy that you are using to take care of that person, and it is just draining your batteries dry. You have to be able to recharge to take care of yourself appropriately, because if you don't take care of yourself appropriately, you're certainly not going to be in a position to take care of anyone else. Now, if you have a loved one that you're concerned about and you're wondering if they have this kind of dementia, then I recommend the following for you, okay? You need to make sure that that person gets a complete physical, and they might be resistant to going. But you need to make sure when they get the physical that they have comprehensive lab work done. You need to make sure they check everything from the thyroid to cholesterol to anything that could possibly be going on that would make the behavior go awry. And then if you know that they use alcohol, it needs to be kept to a minimum and really needs to go to zero because it actually makes matters worse and can make it progress faster. If they smoke, then try to get them to stop. Try your best to try to keep them physically active. It can be difficult because if they are overwhelmed with depression, overwhelmed with anxiety, then a lot of times they don't want to do anything. And you have to really just kind of motivate them to do it. You have to keep in mind, too, that a lot of times as this progresses, they will forget to eat. They won't even remember that they haven't eaten anything all day. And then when they do eat, they reach for something that's inappropriate instead of something that provides nutrition. So you have to make sure that you watch their diet for them. With my mother, as she progressed, she got to where she wasn't sure of herself cooking. And so I was taking her meals every day to make sure that she got the proper nutrition because she would not even eat if I did not take anything over there to her. So you have to make sure that they stay physically active and that you monitor their diet. You also have to make sure that you keep their mind active, get them some puzzle books or something to do because my mother loved the word seek puzzles. So that's what I would get her books to do. And as she would finish one, I would always make sure she would have another one that she could pick up with. If you if the person has sleep apnea, then make sure that it's treated. A lot of people have resistance to treating their sleep apnea because they don't want to wear a mask or they don't want to have anything on their face because they feel like that they're suffocating. But untreated sleep apnea causes heart failure. And so it is important that, and it also causes brain damage and dementia because it affects the amount of oxygen that's getting to the brain. So if they have sleep apnea, then make sure that it gets treated. If they have high blood pressure, then do your best to control it. Try to keep it over those ideal numbers of 120 over 80. If you have high cholesterol, do your best to keep it down because the faster that that sticks to your vessel walls, the more problems that you're going to have. I also recommend that you add omega 3s to your diet to help with the cholesterol issues. And make sure you take a good multivitamin because they have really found that deficiencies in B1, B6, B12, vitamin D, and vitamin E are a lot of times an issue in these patients. I hope that you have found this information helpful. If you have, please give me a thumbs up and don't forget to subscribe to my channel for the further content because I'm going to be covering all the different types of dementia. If you have any questions, don't hesitate to ask because I'll be glad to review them with you. The main thing that I want you to know is you are never alone in this journey. There are people that are there to help you. So make sure that you consult the Alzheimer's Association and see about all of the resources that they have available to you because They don't just talk about Alzheimer's, they talk about all the different types of dementias. And make sure that you look into Teepa Snow's website. She's got all kinds of educational classes and stuff there for teaching purposes. And I also included her website that for YouTube because she actually goes on there and has live sessions that she does question and answers for people that have questions that they can't find the answers to anywhere else. She is a tremendous resource. So make sure that you take care of the information that she has on taking care of a person that has dementia because she will give you a lot of information and a lot of insight on how things are for them and how they see things through their eyes to help give you a better understanding of how difficult it really is for them. So this is all that I have. I hope you have a great day and God bless. Bye bye.